We welcome you to our module Substance Use Disorder, HCCs 55 and 56 from MRA Tips. This module has been developed specifically for MRA reviewers as a refresher on diagnosis criteria, documentation, and coding of substance use disorder. At the end of this module, the learner will be able to describe substance use disorder and its symptoms, identify the DSM-5 criteria for substance use disorder, discuss the severity level of the disorder, review the assessment and plan for substance use disorder. Substance use disorder affects a person's brain and behavior. The person often fails to control the use of any legal or illegal drug that he or she is taking. Many who develop a substance use problem have depression, attention deficit disorder, PTSD, or another mental problem. A stressful, chaotic lifestyle, low self-esteem, peer pressure and anxiety can also cause a person to steer towards substance abuse. Substance use disorders span a wide variety of problems arising from substance use and cover 11 different criteria. The DSM-5 recognizes substance-related disorders resulting from the use of 10 separate classes of drugs. DSM-5 is the acronym of Diagnostic and Statistical Manual of Mental Disorders, 5th edition. It is the American Psychiatric Association's gold standard text on the names, symptoms, and diagnostic features of every recognized mental illness, including drug addiction. The 10 separate classes of substances included in DSM-5 are alcohol, caffeine, cannabis, hallucinogens, inhalants, opioids, sedatives, hypnotics, or anxiolytics, stimulants, tobacco and other or unknown substances. The examiner should screen for symptoms including taking a substance in larger amounts or for longer than meant to, wanting to cut down or stop using the substance but not managing to, spending a lot of time getting, using, or recovering from use of the substance, cravings and urges to use the substance, not managing to do what is needed at work, home, or school because of substance use, continuing to use, even when it causes problems in relationships, giving up important social, occupational, or recreational activities because of substance use, using substances again and again, even when it puts self in danger, continuing to use, even when knowing there is a physical or psychological problem that could have been caused or made worse by the substance, needing more of the substance to get the desired effect, tolerance, a need for markedly increased amounts of opioids to achieve intoxication or desired effect, a markedly diminished effect with continued use of the same amount of an opioid, development of withdrawal symptoms, which can be relieved by taking more of the substance. The characteristic opioid withdrawal syndrome, referred to criteria A and B of the criteria set for opioid withdrawal, or opioids, or a closely related substance, are taken to relieve or avoid withdrawal symptoms. It is important to note that the last two criterions are not considered to be met for those individuals taking opioids solely under appropriate medical supervision. Coding is often based on the severity level. When only 2 to 3 symptoms are present, it is considered as mild severity, abuse. When 4 to 5 symptoms are present, the severity is considered moderate and dependent. And when there are more than 6 symptoms, the severity is severe, dependent. Now, let us look at the remission criteria for the patients. When the patient is in early remission, the following criteria is to be noted. After full criteria for opioid use disorder were previously met. None of the criteria for opioid use disorder have been met for at least 3 months but for less than 12 months, with the exception that criterion A4, craving, or a strong desire or urge to use opioids, may be met. When the patient is in sustained remission. After full criteria for opioid use disorder were previously met, none of the criteria for opioid use disorder have been met at any time during a period of 12 months or longer, with the exception that criterion A4, craving, or a strong desire or urge to use opioids, may be met. When the patient is on maintenance therapy, this additional specifier is used if the individual is taking a prescribed agonist medication such as methadone or buprenorphine and none of the criteria for opioid use disorder have been met for that class of medication, except tolerance to, or withdrawal from, the agonist. This category also applies to those individuals being maintained on a partial agonist, an agonist/antagonist, or a full antagonist such as oral naltrexone or depot naltrexone. Lastly, in a controlled environment, This additional specifier is used if the individual is in an environment where access to opioids is restricted. The assessment and plan should address the diagnosis as current and include 2 support indicators. Let's see an example of a progress note. It differs for initial diagnosis and continued diagnosis after the initial one. Patient name: Julia enters. Date of service: November 26, 2019. Date of birth: April 19, 1954. Assessment and plan. Initial diagnosis: alcohol dependence. Patient tested positive, meeting the first 4 criteria for alcohol. Also has a strong family history of ethyl alcohol use. F10.20 alcohol use disorder, moderate. Counseling is needed, recommend AA. Treatment plan goal: to assist individuals in living healthy, functional lives, in connection with others, such that substance use does not result in negative consequences for themselves, others, or society. Continue diagnosis after initial. Alcohol dependence in remission, used to drink every day. He has not drank in the last 2 years and continues to go to AA meetings for support. We have reached the end of our short refresher course on substance use disorder. We gave you a short introduction to the disease, identified the DSM-5 and remission criteria for the disease, and finally discussed the assessment and plan for substance use disorder. Thank you for joining us.